We talk about nervous system pathology. Most often it's an incoordination, as I've said, but sometimes you get lesions. And Cayce talked about bony lesions, muscular lesions, ligamentous lesions. Sometimes he said circular lesions, floating lesions. And these are all terms, if you go back and look in the osteopathic text, they're saying the same thing. So he's talking their language as to different types. And they're not all bony lesions. Now you might think of the spine being something out of place. But very often it'll be something like just pressure or congestion even. Congestion can be a part of this lesion. So it's not always a matter of putting something back in place. It's sometimes just a matter of getting the circulation working more properly as what's going on. And so in this particular reading, again, 1158-24, a wonderful reading, wonderful series of readings for this person, the 1158 series. He says, not that the segment itself is awry. In other words, maybe there's not the vertebra out of place. When you think of like the subluxation, the chiropractor is going to pop something back into place. He said, no, everything's in place. It's not that it's awry, the segment. He said it has more to do with the connection between the cerebral spinal and sympathetic, and particularly in the sympathetic that's not enclosed in the spinal cord. Okay, these are the connections. Now, same reading, going farther, he said, then in each center, that is the segment where these connect, the sympathetic cerebrospinal, there are tiny bursa, or a plasm of nerve reaction. That's that nerve plasm again. Isn't that interesting? He's talking about the chemistry of the nervous system. To each portion of the system, each organ, each gland receives its impulse. That's that picture we saw earlier where you have the centers and then the impulse to each organ. Same reading. He said, then the science of osteopathy is not merely the punching in a certain segment or the cracking the bones, but is the keeping of a balance by the touch between the cerebrospinal and the sympathetic. That's real osteopathy. You see the point there? Okay, now backing up to here. When he's talking about this nerve plasm, the lapse of the nerve impulse that we talked about in depression earlier, what can produce that? He's saying sometimes it's just a matter that there's kind of a congestion or there's a slow in its activity in these little bursa, these little ganglia. See, they require blood, they require lymph, they have to have the drainages, they can have toxicity associated with it. So if you get congestion in a nerve center, it's like the nerve center has the cold. You know, your head gets a cold and you think it's all stopped up and the circulation's not working. These little ganglia along the spine can become that way. He says not that they're awry, not that they're out of place, but they're just kind of congested. And it's slowing the nerve impulse that's supposed to be going to all these organs. Therefore, the organs don't get the nerve impulse and the system is not quite in balance or you're having problems. And so how do you clean up that little local tissue environment? That rotary massage or sometimes manipulation or whatever, but it's not necessarily popping and cracking of bones. Sometimes it's just the touch. Now the touch, what are we talking about? Holding a steady pressure. What's that? Inhibition. What does inhibition do? It dilates the blood vessels, increases the blood flow, sets up drainages. So when he talks about the third cervical release, hold a pressure here at the third cervical, set up drainages through the whole system. We did a study on that, by the way. I may talk about that later. That's inhibition of this major vasomotor center here. Just holding a steady pressure will set up drainages and cleanse the whole system. Sometimes along the spine, the same sort of thing. You have him just holding gentle pressure, usually bilateral, to coordinate these systems. Isn't that interesting?